Welcome to today's Explainer. We're diving into a topic that honestly affects so many people managing diabetes, but it's still one of those whispered about kind of anxiety-inducing subjects, sexual health. If you're navigating diabetes, you already know the drill. Tracking your blood sugar, watching what you eat, keeping a close eye on your A1C. But today, we're shining a spotlight on a highly sensitive area of your health that's deeply impacted by diabetes, but rarely talked about out in the open. We're going to break down the science, cut through all the noise, and look exactly at what the data tells us about reclaiming your health here.
Medical conditions, not personal failures. Seriously, if you only take one thing away from this entire explainer, please let it be this. When you experience sexual health challenges alongside diabetes, it is just incredibly common to internalize it, right? To feel shame or like you've somehow failed. But the source material we're looking at today is crystal clear. Things like erectile dysfunction, reduced lubrication, or just a really low libido, these are physiological medical conditions. They're a direct result of biological processes, absolutely not character flaws. So by framing our chat today entirely around physiology, we can just completely ditch the stigma and focus on what actually works.
Section 1. The hidden diabetes complication.
Okay, let's dive into this and really look under the hood. There's this huge disconnect between what society tells us and what biology actually shows us. You see, when blood sugar runs high for a long time, it doesn't just float around harmlessly in your bloodstream. It actually causes this chronic, cumulative damage to the exact systems your body relies on for sexual function. In medical terms, we're talking about diabetic neuropathy, which is nerve damage, and vascular dysfunction, or blood vessel damage. Basically, your sexual health needs precise nerve signaling and really robust blood flow. When high blood sugar damages that internal wiring and plumbing, the physical response just can't happen the way it used to. It's a mechanical and biological chain reaction, plain and simple.
Section 2. Key lifestyle management changes.
Now, understanding the biology is super empowering, but knowing how to fight back, well, that's where we actually win. These lifestyle changes aren't just some chore. They are literally your first line of defense. And number one on that list is optimal glycemic control. The data points to getting your blood sugar levels in check as the single most powerful intervention out there for both men and women. Think about it. If chronic high blood sugar is the culprit damaging those nerves and blood vessels, stabilizing those sugar levels is the ultimate way to put the brakes on that damage and let your body function the way it should. It's the foundation that every single other treatment is built on.
And the other half of that foundational equation? Regular exercise. The research specifically highlights incorporating physical activity to boost sexual health outcomes for both genders. Makes sense, right? If we're trying to repair blood vessel health and reverse that vascular dysfunction, what better way to get the blood pumping than through consistent physical activity? Exercise acts as a fantastic vasodilator, which just means it helps open up those blood vessels. It is the absolutely necessary physical counterpart to managing your blood sugar. The two just work perfectly in tandem to boost your body's circulation.
Section 3. Medical interventions and screenings. Since we've established we're dealing with real medical conditions here, it naturally follows that real, effective medical treatments actually exist. But for the guys tuning in, I want to pose a pretty serious question based on the medical data. Could ED mean something more? We so often brush off erectile dysfunction as this localized issue, just a frustrating inconvenience confined to the bedroom, but the medical research is telling us the stakes are actually way, way higher.
That brings us to a concept you really need to be aware of: silent heart disease. Basically, the very same blood vessels that are struggling to perform during ED are kind of like the canary in the coal mine for your entire cardiovascular system. Because the blood vessels responsible for an erection are so much smaller, they often show the signs of vascular damage years, literally years, before the larger arteries near your heart do. So treating ED isn't just about restoring sexual function. It's an absolutely critical screening opportunity. It can act as a vital early warning sign for hidden heart conditions, which directly impacts your longevity and overall health.
And hey, we definitely can't ignore the secondary complications. Having elevated blood sugar basically creates an environment in your body where other annoying issues just thrive. Specifically, having excess sugar in your urine is pretty much a buffet for bacteria and yeast. This direct biological link leads to a much higher rate of urinary tract infections, or UTIs, and yeast infections. And let's be real, these aren't just uncomfortable, they completely kill your desire and severely impact sexual health. Just like the primary symptoms, these absolutely require proactive, professional medical care to manage and clear up.
Section 4. Breaking the silence.
Okay, so we've got the data, we understand the biology, and we know what the solutions are. So what's the holdup? Well, the stark reality is that doctors may not always raise the topic during your routine consultations. Appointments are just so incredibly short these days.
Your diabetes team is usually rushing to check your A1C, review your daily numbers, maybe check your feet. Because sexual health issues are often underreported by patients, usually out of embarrassment, and overlooked by doctors who are just strapped for time, this massive communication gap opens up. The help is sitting right there, but nobody is asking for it.
So here is your clear, proactive game plan to bridge that gap. Step 1. Take control of your blood sugar. That is your absolute foundation. Step 2. Exercise regularly to really support that vascular health. And step 3, you've got to ask your doctor directly. You really need to feel empowered to start an open, honest conversation with your diabetes team. Walk right into your next appointment, look them in the eye, and feel free to use this exact script. Hey, I'm experiencing some changes in my sexual health, and I know this is connected to my diabetes. I want to discuss treatment options. It's a medical condition, right? So ask for medical help.
Which leads us to our final thought for today's explainer. We've seen that the treatments are out there. We've seen that this is truly a matter of plumbing, wiring, and blood sugar. Absolutely not a personal failure. But we also know the reality of the modern doctor's office. Your doctor might not bring it up. So when will you? Please don't let silence stand in the way of your health, your longevity, and your quality of life. Take this knowledge, step into that doctor's office, and take the reins. Thanks so much for joining me today, and I'll see you in the next one.